There's significant evidence that demonstrates that transitions of care for patients moving from one location or site of service to another disadvantages the patient both from their satisfaction and their outcomes. And therefore, we've worked to build an integrated system of care delivery here at Urology of Indiana, not just around BPH, but around cancer care and many other urological conditions. We've built a team of experts along with the industry-leading IR centers around the prostate arterial embolization procedure that are able to provide that procedure to dozens of patients per week here in the central Indiana area.
Urology of Indiana provides personalized care for all patients. Many patients have been with Urology of Indiana for decades. With a continuation of expanded service lines, Urology of Indiana continues to keep patients under one roof at a discounted price when comparing to hospital prices. Patients prefer to keep their care at Urology of Indiana. They have already established their care with a physician that they feel comfortable with at a facility that they already know.
There are many disadvantages to referring patients to outside centers for their treatment. Error in communication, records need to be shared, redundant testing, potentially sending patients to a center where maybe there's a disagreement in what treatment needs to be offered. And so by providing those services within Urology of Indiana, there's no difficulties with communication. The team works together deciding what's best for the patient.
This is a team sport. Teams here are so critically important. We like to collaborate with the urologists, the NPs, the PAs. We get information from them, we learn from them. The doctors work together at every point of care for patients who come into Urology of Indiana. Everything becomes a very smooth process with no interruptions in the transition of care from the urologist to the nurse to the interventional radiologist.
We know the techniques, we know the technology, we know the data, and we know the patient. Medicine oftentimes exists in silos, and here at Urology of Indiana, when you come into the practice with lower urinary tract symptoms, your workup, all of your information is easily shared with all providers. We see these patients early on, we guide them through medical management, and then we're here to provide support with them as they potentially move on to surgical therapy or more advanced therapies for BPH.
We feel at Urology of Indiana that it's the urologist's responsibility not only to identify these patients, to work them up, to provide them with counseling on the various treatment options, and then help navigate their care through those treatment options, whether they're receiving them at Urology of Indiana or if they're provided by another specialist. Interventional radiologists are now bringing procedures that are highly beneficial to patients, and by working together with them rather than in silos of care, we are providing an approach that has already been demonstrated to be successful in the care of the cancer patient and bringing that to the BPH patient, which is why it's so important to us that we've brought prostate arterial embolization into the practice here with IR centers and are providing that in the same setting.
Prostatic artery embolization is a new procedure that can be offered for size reduction, improvement in urinary symptoms, and also has the potential to avoid some common side effects that men are fearful of when considering surgical therapy for BPH.
Ultimately, what we do with prostate artery embolization is navigate small catheters inside the arteries to get to the prostate. What we want to do when we're there is close down the blood flow to the prostate. So we have tiny microcatheters. They're special medical devices that I can see with our fluoroscopy machine. As I'm navigating them around inside the arteries, we direct them to the prostate arteries. We infuse these tiny microspheres, medical devices that are like grains of sand essentially, and we slowly infuse them into the prostate arteries, thus cutting down the blood flow. We're trying to basically starve the prostate. So once we close this blood flow down, the prostate no longer gets oxygen or nutrients or hormones. Ultimately then undergoes a process of involution where it shrinks. The biggest impact of shrinkage is in the central portion of the gland, which surrounds the urethra and thus relieves that pressure that's been on the urethra, causing the symptoms that come from BPH or benign prostatic hypertrophy.
So it potentially offers a patient a BPH procedure that is done in an office setting with oftentimes very minimal to little anesthesia, a procedure that takes an hour and a half to 2 hours, and something they can go home the same day, often without a catheter. So when the patients are considering possible intervention for their BPH, prostatic artery embolization has some things that patients are interested in from just an ease of going through the procedure.
The key here with providing prostate arterial embolization procedures at Urology of Indiana is that we have a team of providers and nurses that already know the patient, and the patient already knows them. And so there's already a relationship there, and that patient is just simply moving on to another procedure that's provided by a different specialist, but within the same Urology of Indiana setting. And so patients are able to not only interact with those that they're familiar with in a familiar setting, but we are also familiar with the patient.
The doctors being in the same office really allows for us to provide the best patient care. We use clinical evidence-based medicine, and we communicate that between each other so that the patients can get this type of innovative care and get the best patient outcome from it.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.